watching Rogers TV.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I'm delighted to have with me as a guest Svet Milanopulus. Svet is a public health inspector for Grey Bruce Public Health, and today our topic is about safe water and especially testing private water systems. Svet, thank you so much for being here today. I'm going to push down my little Zoom there, making sure I can see you and you can see me. So I do have the questions that were sent on ahead, and that's great. We're certainly going to use those. And any additional information that you have to share, just throw it in, because like I say, the more you talk and the less I talk, the better the show. So tell us a little bit about yourself first, how long you've been with the health unit. Well, it's not the health unit now anymore. The name is Grey Bruce Public Health, right?
Yes, that's correct. I've been with, my name, like you said, is Svet. I'm just one of the public health inspectors within Grey Bruce Public Health. I've been with the organization for over 20 years, and we have several geographical areas within Grey and Bruce counties that we cover. So they, as an inspector, they try to switch the locations that we service every 4 to 5 years, so that we don't get too accustomed to dealing with specific individuals. Yeah. So we transition that way. So I've been throughout Grey and Bruce counties, providing all our 9 programs as public health inspectors. And water is a large component because we do have some rural areas and some urban areas that are still depending on private wells to supply the drinking water. And those are the systems that we're going to be talking about today, because it's important for the private water systems to know the quality of the water that they're consuming. If you're in a municipal system, that is already being addressed for you because the municipality does the sampling. But for private well owners or even individuals that draw water from surface water, some cottages are in that situation, it's still considered to be private water, and those systems should be sampling. Throughout, we've had a name change. So we used to be Grey Bruce Health Unit, and now it's Grey Bruce Public Health. But a little bit of historical connotation with the water program. Just like our name change, we had to last fall we had to transition from our old water drop-off locations and pickup locations. So we have, during COVID, we depended on the grocery stores, and there was, and for 2 years, a little bit more than 2 years, that's what the system entailed, going to 5 locations throughout Grey and Bruce. And the system, it was arduous for the grocery stores that helped us out with that system. So after the 2.5 years, now we're extremely appreciative to the municipalities, because that's who we have partnered with. And so our drop-off locations have transitioned, going from 5 locations to 14. So the system is more equitable for the population within Grey and Bruce counties. So that's a benefit. Yeah. And a large thank you goes to the municipalities who are hosting the fridges and the water bottles where you can go and pick up and submit at that locations. So that it was a large endeavor. Last fall, it all came to happen to fruition, and overwhelmingly positive feedback.
Okay, good.
Overwhelmingly, yeah.
So now, so it's gone from 5 to 14, and that was certainly something I was interested in, was how was the expanded system working out? Now, this is free at the, right? For people to get their water tested is free?
Absolutely. The free service is there's several agencies. Public Health Ontario provides the free service. And they so it is thanks to Public Health Ontario that we have this for everybody in the province.
Yeah.
They provide the lab and they do the analysis and the reporting back to the submitter. So large portion, it is a free service. With we encourage everybody to utilize this free service 3 to 4 times a year, especially
Mhm.
when a season changes. But otherwise, much more frequent sampling if you notice color change, taste change, or then the quality of the water.
Yeah,
We would encourage even more
yeah,
sampling, but at least 3 to 4 times a year. So the overwhelming positive feedback that we did receive was because it is much the five locations previously. There was some communities within Grey Bruce that had to go far to access the drop-off locations. So in that retrospect, the service has improved. There was some issues with whenever a new system is being implemented, you have to adjust. So the times of the accessible system where you can drop off and have changed. So that took some time to getting accustomed to. And we'll see this summer because in the summertime the service becomes much more utilized
yeah.
because of our tourists, our cottagers. They do want to, especially for them, if it's they need to know the water quality that they have. So overall, it's been good.
And which is great. So in the municipalities, I mean, the buildings are not open 7 days a week. There's only, so what would your suggestion be around, best times or best days, or how would it work in a person's schedule? And is there a time frame for drop off to getting it tested? Like how long does the
Yes,
water okay to be in one place without being
yes, ma'am.
tested?
So here, there's a couple of questions there.
Yeah.
First of all, let's address that if your water sample sits for more than 48 hours prior to getting analyzed at the lab will turn it away. So the sample from the time that you take it to the time that it's received by the lab, it has to be less than 48 hours. So in relation, the way the drop-off locations work, we have divvied it up from Grey County. There's several locations, and Bruce County. There's several locations and in Grey County, the pickup location, the pickup courier, it occurs on Wednesdays, and every location has a certain time.
Yeah.
And this, because there's multiple, it becomes difficult to communicate it. So for the viewers, if they go to Public Health, greybruce.ca, our locations where you can drop off and pick up are there, and the times when the courier goes. So in Bruce County, it's on a Wednesday, and then on Grey County, it becomes on a Friday that they pick up. Out of all the locations that we have, there are two locations that you can drop off any day. as opposed to just the Wednesdays or the Fridays, depending on which county you reside in. In Owen Sound, at the health unit, you can drop off a sample 5 days a week. And in Walkerton at the community center, you can drop off 5 days a week. Apart from those two locations, Wednesdays are for Bruce County, and Fridays for Gray.
Right.
And so that's a little bit descriptive of how it works and the times. And thank you for reminding me that if the sample sits for more than 48 hours, it will be turned away.
So going on your website and really being clear about the schedule is best advice for people, because it varies, right? Depending on where you are. Where would I pick up the container to actually test the water? How would I get that?
The containers, this is a sample package that comes, and each drop-off location will have the water bottles that are submitted with instructions, and then how to fill it out, and the barcode is instrumental. So you can pick up the water bottles and submit them at the same 14 locations. And check our website for the schedule. You can print a list from it, or contact the health unit, and we can help you out with the logistics of how to get it.
Excellent. So you mentioned it goes to a lab. So where is the lab, and what does the water get tested for? What do you, not you personally, but what is the lab looking for in the water testing?
Right. The lab where all the water samples go to is in London. So the samples get picked up by a courier within our within both counties, and then the courier the samples get sent to London Public Health Lab.
Okay.
So they got to travel all the way there. After the samples get analyzed for total bacteria. So if we're, that's all that is addressed in these samples is bacterial contamination, and we look for total coliforms. There's a certain parameter. If it exceeds that number in total coliforms, which is 5, it's considered to be adverse. And we also look for E. coli. E. coli is another organism that indicates that the animal waste or human waste, fecal material has and for the E. coli parameter, 0 is the only acceptable, because that is very pathogenic. It could be a pathogenic source. The total coliforms are used more as an indicator organism. And we say that if you have higher than 5 total coliforms, then surface water has the ability to enter the well and introduce bacteria. And if E. coli is entered, not only there could be E. coli that's on the surface water, fecal material entering the through that way, or it could be from our septic tanks, could be if there's livestock, could be if there's a manure pile, storage on the farms. So those are some of the sources of the problems that can enter, and those are, so if you're looking for bacterial, that's the analysis that gets done for total coliforms and E. coli.
So take me further along the process. So it's been tested. How would I know the results? And so I'll let you answer that. And then I have a follow-up I want to ask you after that.
So as soon as you bring in your sample, you have to fill out the form. Within the form, every sample has a barcode, and that's the barcode that is tracked to your residence. So the way, so once you have submitted the sample, you can utilize that barcode and call a 1-800 number that's on the card where you can keep that barcode. It's a 1-800 number. And 4 days from taking the sample, you call that 1-800 number, you punch in your barcode, and an automated machine will tell you the results right away. And that's if the barcode matches, that's how you know that it is yours and the automated machine. If you select that, you can also get the results mailed to you, but instead of waiting 4 days, you have to wait 7 days in order for the mailed results to arrive to your residence. So I encourage individuals, even if you checked off on the form that you want it mailed, keep that blue card, stick the barcode of your water bottle onto it. 4 days from taking the sample, call, and then you can retrieve your verbal results, and then wait a couple more days, and your mailed results will arrive. So essentially, that's how it works. And then if it's adverse, you're advised to. It might have been your follow-up question.
You got it. Go ahead.
So if it is an adverse result, so anything over 5 total coliforms, the lab will send a letter indicating that your water has evidence of contamination, and please consult your health unit for further advice. And when we receive those phone calls, we walked the owner of the property, the individuals who are drinking the water, on disinfection. We can render that water safe by boiling it for 1 minute, and then all the bacteria get eliminated that way. But you can also treat the contaminants in the well by a short-term measure, which involves applying bleach to the drinking water, so chlorine, and it's called shock chlorination. That's a short-term treatment, because if your well is under the influence of surface water, any new surface water entering is simply going to recontaminate it. So you can boil it to still have available source of water. Then we tell you how to treat it for shock chlorination, or if it's a systemic problem that multiple samples have been taken and throughout the years, and we know that there's contaminate, then we would advise a more permanent solution to this, and it's a treatment unit. And the cheapest way to do it is through an ultraviolet light. So that's essentially how we walk the individuals through the contamination process. If we can fix it through shock chlorination, and we tell the individuals, and our website has a wealth of information as well, but we walk the individuals how much bleach for how long it should sit in the well, and what to do to flush it, and then resample and see what if it was productive. And so essentially, it's not the end of the world, because we can treat it by boiling, but it creates gastrointestinal illnesses. So it is important to you don't want to be continuously succumbing to those illnesses.
And I think that's really critical. I mean, it definitely can affect your health in very negative ways, for sure. Safe water means staying healthy and away from pathogens that are in the water system. So climate change, we're hearing a lot about climate change and some of the issues around floods and flooding and rain events. Do you anticipate that this may increase the demand or the need to test wells or private
Absolutely.
systems more? Would your
Absolutely.
advice to people be better safe and always test after heavy rains, or what would you say?
Most definitely, especially that is one of the main sources of contamination coming in. If you can imagine these wells, they're built so that you have 40 centimeters of the casing extending above the ground. But if there's a flood, and there is a lid on the well, but if there's a flood, that's where those opportunities come in and introduce the contaminants that way. Especially if your lid is cracked, if the casing is cracked. So absolutely, not. That's why we encourage individuals to test when there's a change of season, because we're either experiencing runoff, snow melt, and that's when we want to know if our well is vulnerable. If And after a flood, especially if there's a notice of change in quality. So sometimes that's what happens with environmental. If somebody worked on the well, there could be an introduction of bacteria that way. Humans can introduce it, but a flood is definitely one of the other reasons to augment. So if you typically go 4 times a sample, and that's what you like to do every year, and it becomes a habit, so then you don't think. The only times that you would augment that is if there is an adverse event, and flooding is definitely one of them.
So you've described about the wells and they're above, I think you said 40 centimeters.
Yes, ma'am.
Yeah,
40
40.
centimeters above ground. Yep.
So is there anything additional I can do for my well system to protect it even more? Is there, how
Indeed.
can I cocoon this well so it's safe?
Right. So sometimes cocooning might be even more of a problem. So
Okay,
yeah, you don't want to cover it. You don't want to, absolutely. So that becomes, if there's a heavy garden around it, then it might allow
yeah,
for the water not to drain. So it's
okay,
very important to know where your well is.
yeah,
And once you have to ensure that the inspect it once in a while by removing the lid. If you see stains in the casing, water stains, so that's your indication that somehow water is entering it. If the soil around the well has to be in a formation that the water goes away from the well as opposed to standing. So sometimes the debris around the well doesn't allow water to leave the well site, and if it remains stagnant, then there's more opportunity of it for entering.
yeah,
Um, so you have to ensure that the area around the well is kept clear of debris, brush, potential contaminants like chemicals, fertilizers. You have to have the proper distances from livestock,
yeah,
50 feet from your septic. So all these distance requirements, the soil around is protecting your source, and that's the main component of the water quality is protecting the source and then monitoring it,
yeah,
if to see if so what happens. So the construction is one thing. The annular seal space can the seal can wear off with time. So cracks in the casing is another indication
yeah,
that there's a problem. But if it's not obvious like that, there's even a screen for the vent and insects. If there's no screen by the vent hole on the well cap, that's an area where bugs can go. So it's as simple as proper screening on the vent opening could prevent. So if you don't have that'd be a way to improve it. If your well is not 40 centimeters high, increase the casing. It'll if the land around it is too close to contaminating sources, we would correct that. And that's always the first step, is protecting the well, and then monitoring is the second equation to. And I don't want to downplay the severity of this, because I did say it's not the end of the world if there is contamination. I just mean that for the viewers not to get too anxious, because we can get corrected. The problem can get corrected. But if you simply choose to ignore and not test it, these bacteria, like for E. coli, for example, can develop to kidney problems. So it's not just simple gastrointestinal illnesses. Some of these bacteria that end up have complications afterwards. So I just want to have that clear, and that's why we encourage the testing.
In other words, don't be afraid to check out your well system often. You mentioned about monitoring and how important that is. Once a year isn't good enough. It needs to be more often. And, just ask, if someone wasn't sure what to do, to approach, and would a health inspector then, go forward and speak to people about what to do? Yeah,
Most
so
definitely.
you're there to provide that assistance and to give advice. Like, I think people might be, apprehensive if they get an adverse result. But what you're saying is, it is fixable with some strategies.
Absolutely fixable, and it's a new well can have contamination as much as an old well, so the age has no limit on it. There it's important to do the testing, so that we have an indication.
Yeah.
Absolutely.
I mean, safe water means being healthy, staying healthy for all of your family, for sure. That sounds like such an important role for public health, for people who are on a private system, to be able to, and also the 14 locations is a big plus. We've got a minute left in the program, Svet. Is there anything you want to just throw in at the last little bit?
For your viewers, please do not hesitate if there is some evidence of contamination to call the health unit. There's always a public health inspector on the phone duties, and we respond within 24 hours, and we can provide you some assistance on how to remedy the problem. Absolutely, we're available every day.
Excellent.
Count us as a source.
Yeah, so when in doubt, check it out. Call the health unit, or not the health unit, public health now, and get advice. Svet, thank you so much. This is such an important topic, and I always appreciate speaking to you about it. So I look forward to speaking to you in the future as well about the program. Thank you. And thank you to our viewing audience for joining us today to learn more about programs, resources, and services available to you and to your family. Take care, stay safe. Thank you.
Connect with us by visiting our website or email us at comments@rogerstv.com.
October 5th, 2014, my daughter was hit by a train. She was walking along the sides of the tracks, and it shattered her world.
It's been a long time coming.
You don't win it to keep it, you win it to be a part of its history.
Always knew
Always hard to see the difference between winning and losing.
how to steal.